Hello, guys, and welcome back to Med Indian. As a new intern, you've just passed your final exams and you are super stoked that you are finally a doctor after all this studying. And once that euphoria dies down, you realize that there's another exam that is right around the corner, and you don't know if you want to leave the doctor's life by working and learning or get back into the grind and prepare for another exam that is NEET PG or INICET or FMG. And this is where all the confusion arises. Should I prepare? Should I study during my internship or not? This question has no single best answer. It depends on so many factors: how hectic the internship in your college is, how much effort you are ready to put after working, how well you have prepared during your UG days, what type of a person you are, and what your priorities in life are. It is perfectly okay if you just want to enjoy your internship, learn as much as you can, read up on whatever you're seeing every day, and then go back and relax at home, or want to use that time for your hobbies or to relax with friends, travel, and do whatever you want. You can do that. Or you can be one of those who don't want to waste on whatever you've already built and want to go with the flow and finish off reading for the exams and try and clear it in the first attempt. Internship experience, to be honest, is different in each and every college. And even in the same college, no two people will have the same working hours, same duties, same amount of free time, and same kind of seniors or the same kind of experience. Every person is different, and how they deal with the different situations in internship is also going to be different. It is entirely dependent on you to decide how you want your internship to be. It's absolutely fine if you do not wish to study during internship or just want to learn while working and enjoy your free time. You'll learn to handle stress, you'll learn to the art of talking to patients, the talking to attenders, how to tell them about bad prognosis, and empathy, sympathy, and you can also learn to handle interpersonal issues like with your co-interns, seniors, juniors, and learn the skills. But don't know how it is for the next pattern. And also, it is absolutely okay if you wish to get to studying and try and clear the exam in your first attempt. There is no shame in either of those, and don't just do things just because someone else is doing it, or don't judge people just because of their choices. Take your decision, and whatever it is, do not regret it later. Ask yourself what you would want to do with your life and do what best suits you. If your choice is to study, then you should be ready to put in a lot of effort consistently, because it is not going to be easy to squeeze in time after a hectic day of work consistently. But you have two big advantages. One is the questions in NEET are becoming more and more clinical, they are case based questions, and you are going to be exposed to all the departments in internship. And if you show some interest in your work and read up a bit then and there itself of all the cases that you're seeing, you will be able to answer lots of questions, especially NEET and also INI. The second point is that you are fresh out of fourth year and you have recently given your exams. So your major subjects will be much easier for you, and it will take lesser time to complete them, and you have to concentrate more on your first and second year subjects. That is why most of the toppers in 2022 NEET were interns. Managing your time becomes the most important thing with internship. You can try to make at least 4 to 6 hours for studying in a day, and that should be consistent. So plan your day in such a way that you are going to keep or cover the theory and the notes before or after your duty hours, and keep the MCQ solving, Anki, and the related topics to whatever cases you are seeing within the working hours of the hospital, as and when you get time, like when you're taking a patient for reference, or you're waiting for reports, or you're waiting for the investigations to be put up, or whenever you're getting time. This is because you need more time to study theory or notes, because that needs a lot of focus and concentration, and that has to be in a flow. And if you're being called again and again for some of the other work, you will not understand. There is going to be no continuity. So it is better if you can keep the reading part to when you get back to your hostel or your house. If you are not able to make 4 hours, even 4 hours in a day, and if you are having a very hectic day and you don't have the energy to do anything, At least make it a point to finish the daily pre-PG test that is of 50 questions, just 35 minutes. Or you can even see one of the classes of MER or must know topics of Zainab ma'am at 1.5x after the class. That is like passive learning, but you will also be learning something at the same time so that the whole day does not go waste. And her classes are generally very fun and light but filled with important information, so it's going to be like it is like a mini medical Netflix. So but you should make sure that you start your next day by reading the annotated PDF or whatever you listened to the class the previous day, so that you remember it in the long run. Whenever you're having a very hectic day, don't get too bothered about it, because you're going to learn on the go. Learn actively from everything that you're seeing around you. So you're putting an IV cannula, keep reading the labels of IV cannulas, the Foley's NG tube, central line. They'll have all the color, size, flow rate, and you'll know, get to know the indications and when you use them, how you use them. Then if you're in the OT, see the instruments, the draping, the position of the patient, then the cautery, what is being used, what the anesthesia people are doing. Ask them questions. There'll always be someone who is ready to teach you, and you can learn from them. You can also learn the anatomy and the relations of the structures that are being operated on. In the previous NEET, there was a question on procedure of OT from Oftal OT, where they had given keratoconus after surgery. You can learn dermat procedures, local blocks. Make sure that you are reading the topics that you are seeing as cases in your wards or the OPD or in the OT at that time itself, or whenever you are getting time. For example, you are seeing a case of DKA, read up about that, correlate with whatever you did for the patient, and that topic is done at that point itself. Schedule and postings. You can do this in two ways, depending on how hectic of an internship you are going to have. One is, if your postings are heavy, you are going to read up the easier topics or the short subjects. And whenever you are having a short posting or when you are having a lighter schedule, you use up that time for the bigger, most difficult subject. Or the other way is to schedule your timetable in such a way that it correlates with your posting. And if you use this method where you are correlating your postings with the subjects that you're going to read in the same posting, then it is going to be easier for you and it is not going to be an overlap in your mind. But of course, it can be very hectic in some of the departments, can be very hectic in some of the hospitals, and it might not be possible to do the like subjects like medicine with medicine, because you cannot get that much time to finish medicine, and medicine is vast. What I would suggest for interns is, because their fourth year subjects are going to be fresh, I would suggest going for the first and second year subjects. Give that priority first and then go for the fourth year subjects. And because all of the fourth year subjects also have the departmental postings, like at least for one or 2 months in most of the hospitals, it is better if you can correlate with that. So this is the sample timetable that I could think of, the best way to go about with scheduling the preparation. So the schedule has been made keeping in mind 12 months, and out of which last 2 months would be kept for revisions. So the subject that you have in the end, say for example in this schedule I've taken PSM as the last subject that is going to be there, that is the last posting that is going to be there. So the last 2 months is going to be for revision, so we have to fit in PSM in some other place in the preceding 10 months. So I have given this timetable where for example you have medicine with psychiatry, that is how it used to be. So it might be different in your hospital. So if it is medicine with psychiatry, I would suggest going for patho and pharmac with medicine posting, because patho and pharmac you would have forgotten, but medicine you would have just given an exam. And when you have psychiatry posting, add psychiatry and parts of the medicine, that is the patho and pharmac that is still remaining. And you can do your medicine topics when you have casualty postings, if that is not very hectic for you. But if that is hectic, then you have to make time for medicine somewhere else. So ideally, if you go by this schedule, this is how the 2 months of your medicine posting would look like. There are 60 days. So if you take about 5 days for psychiatry, in total you're left with 55 days for patho and pharmac, where you have to finish patho and pharmac when you have time after the posting. And during the posting, you make sure that whatever cases you are seeing, you read up about them, at least whatever was done for the patient with respect to the treatment, investigations and all those things in the hospital itself. Then coming to next, if you have casualty or emergency medicine posting, it would be better if you can finish off trauma surgery and surgery, emergency surgery in that posting, and medicine if you have time, or if not, you can see only the cases and read up about those cases like pneumothorax. You see what they were doing, what is the procedure they did to treat the patient, all those things. In casualty, you will get to learn a lot. So it is okay if you like on the job, you will learn a lot about how to handle patients, how to talk to them when they're at their most vulnerable state. So it is okay even if you don't get that much time to sit and study. So keep that as a lighter posting for your studying, and if you get time, read up on some short subject if that is what you want. Next, coming to surgery with anesthesia, the 2 months I would suggest going for anatomy of all the structures except the limbs, because limbs you can study with ortho, and anatomy with surgery. And surgery, if you have already finished trauma during your casualty, better go for surgery except trauma. And in general, in our hospital, it used to be surgery with anesthesia. So if there is anesthesia posting for you, take 5 days of that time for finishing anesthesia. Next, with your pediatrics postings, if it is for 1 month, you can put pediatrics and biochem together, because biochem also has all these storage disorders, genetics, and some similarities are there between biochem and pediatrics. So you can finish your pediatrics as well as biochem in your pediatrics postings. Next, coming to when you have orthopedics, that is if it is for 1 month, I would suggest going, depending on how hectic your ortho postings are in your hospital. 1 month would be for anat, limbs, that is upper limb, lower limb, along with ortho. If your orthopedics postings is not that hectic, you can put in one more subject that is a part of physio in this, so that you'll get time for revision in the last 2 months. Next, when you have ENT, do ENT plus micro, so that in 15 days, I would suggest going for 5 days or less for ENT, and micro in the rest of the time. All these are like kind of stretched timetable, because you're putting in only 4 to 6 hours in a day. If you get more time, you can always add whatever subjects you want to add. Next, when you have your elective postings, or when you have the short subjects dermat and radio, you can finish dermat, radio, and one more subject. If you have not been able to do medicine, this would be the ideal time to put medicine or one of the longer subjects, but you don't have to do each and everything in medicine. Better go for your notes if you already have them, because most people would have used one of the other online resources during their 4th year prof exam preparation, and if you already have your notes, it is better to go for the notes and finish off the subject with the short postings. Next, when you have ophthal postings, you can finish ophthal and PSM, because I was considering the last 2 months as PSM had to be put somewhere, so ophthal with PSM would be together. And when you have your OBG postings, you can finish OBG and forensic medicine, because on the job you will be learning a lot on OBG, and whatever is more hectic, like for example, most hospitals have labor room duties which are more hectic than the normal wards and OPD. So if that is the case, then go for forensic in the labor postings. So in the last 2 months, you will have to revise whatever you have done. So it is better if you have concise, crisp notes in internship, and you are reading the most high yield topics. One more thing that you can do about the casualty postings or the emergency medicine posting is, if you have very hectic postings and you're not getting time for actively studying everything, you can go ahead and see all the emergencies videos by Zainab ma'am, which has covered most of the emergency cases, pneumothorax, appendicitis, everything that is going to be asked in the exams, and you can cover that topics, passively see the videos, and then read up the PDF during your postings or when you have time. Source. So it is very important to get a very crisp and concise notes for your studying and revising, especially in internship, because of the lack of time. If you have already made notes for all the subjects during your professional exams, that is the UG days, then it is better to go for reading the notes directly and revising and solving MCQs, previous year questions, and doing repeated revision is most important. If you don't have those notes, it is better if you can read the notes and try to understand them and solve the questions. If there is some place where you are not able to understand the concepts, then only go for the videos. Otherwise you're going to take a lot of time in compiling the notes, and that will take up most of the time and you will not get time to read and revise. Even if you have to watch videos, make sure that you're watching them at 1.5x to save time. And in most of the places there is no time for you to go and attend offline classes. If there is time, then you can go and attend offline classes, because that way you will be forced to do that. But most places don't allow this. If it is possible, then go for it. If not, then if you're doing it on your own, make sure that you have a proper schedule and you follow that. GTs and internship. One thing that you can do that is different from what others or the post interns will do is you can solve the previous year questions or the previous year exam paper as a whole, as few of your GTs, like the first few GTs. You can just solve those 5 year papers, so that you will get a hang of the exam, the high yield topics, so that you can see whenever you're seeing that case, you will be more prepared to read up more on that in your postings itself. And also you will be doing it in 3 hours time as a GT, so you're getting a good hang of how the GTs will be, the previous year questions were. You would have done both the GT and the previous year questions at one go. That is one trick that you can use. But of course you will have to solve other types of questions as well to know how the pattern is and how good a MCQ solver you are. One more fun and really good approach would be to attend medical quizzes or departmental quizzes. So this way you will be finishing more subjects in less time. Like you might have heard of Parkinson's law, which says that work expands to fill the time available for its completion. This is basically what explains why we can or how we can finish the entire portions a day before the exam than what we could finish in the whole year sometimes. Like you would have experienced this during your university exams. So if you're attending a department quiz or an inter-college quiz, you'll have a deadline to finish the portions in that duration of time. So you'll somehow manage to read up the most important topics. And it's also fun because you're competing with others, you're enjoying and learning, so that makes it more enjoyable as well. And if you've seen topper interviews, many toppers in NEET and INI were actively participating in quizzes, and they said that was mainly responsible for them to get good ranks. There are many platforms, online platforms also, that are conducting quizzes like these. Like there is the White Army, which conducts quizzes, departmental as well as the entire syllabus quiz for interns, post interns, and also the UG students. So actively participate in these, or you can even participate in DAMS quiz. There are so many platforms other than that, and also your own department in your hospital might be keeping quizzes that you can participate in. Once you've made the decision to give your best attempt in your internship, don't be half-hearted about it. Commit to it and give it your all. And most importantly, don't compare yourself with others, what your friends are doing, how much they have studied or not studied, or how much fun they are having. Don't let what others tell or what others are doing bother you, because there will always be people who will discourage you. It is not possible during internship, or you're from a private college or from a government college. There's such a hectic internship. How will you manage both? It is definitely possible. It is definitely possible. You just have to put in a little more effort. And don't stress over things that are not in your control. Somebody else is getting a lighter internship, your friend is getting more time to study, your friend has finished more subjects, more portions, has solved more MCQs. All of these don't matter. Important to keep in consistently putting your effort, the best effort that you can give. Don't have unreasonable expectations, because you're managing both studies and work. There will be days when you can't study at all. But don't waste the time that you have got in your hands in thinking about the lost time. What is lost. In the worst case scenario, even if you're not able to finish according to your schedule, whatever you have studied will be a good foundation for you to get a very good rank in your May INI or in November INI CT. So don't worry about things that are not under your control. Keep putting your consistent efforts. and you will get there. It is definitely possible. And all the best. Thank you so much for watching. If you found this video helpful, please share it with your friends and also subscribe to the channel.